Hi everyone, I am Dr. Diptadhi Mukherjee, working as Assistant Professor in the Department of Addiction Medicine, LGBRM Stage 4. So let's discuss about addiction. So what is addiction? Addiction, also known as substance use disorder, is when people become hooked on something like a substance or activity, even when they know it's harmful. It's a bit like being a slave to it. Worldwide, if you see, about 1 in 7 people will experience addiction at some point in their lives. The term addict comes from the Latin word addictus, which means to devote, sacrifice, sell out, abandon. So there is a old story behind it. So this story is about a slave named Addictus who was set free by his master but still wandered around with his chains, even though he could have taken them off. This helps us understand that addiction is like a disease that changes your brain, making you feel compelled to keep using the harmful substance or engaging in harmful activity. So, now let us take a closer look at the American Society of Addiction Medicine definition of addiction. It defined addiction as a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. So, as you can see, there are four components to it. One is brain circuit, another is genetics, another is environment, another is individual's life experience. So, these are the main etiology or causative factors behind addiction. And another thing that they have emphasized is it's treatable and chronic medical disease. So they have given a medical model to addiction. So people with addiction use substances, engage in behaviors that become compulsive and often continue despite harmful consequences. They have also added prevention efforts and treatment approaches of addiction are generally as successful as those for other chronic diseases. Now, what are the addictive substances that are there? In India, substances that are frequently identified as addictive can be classified according to their legal status. Legally available substances are alcohol, different forms of tobacco, inhalants, and to some extent prescription drugs like sleeping pills. Whereas cannabis, opioids like heroin, stimulants like cocaine, meth, and hallucinogens like LSD, also called acid, are illicit that are prohibited under the law of the land. So, what is the scenario in India? So, as you can see, tobacco is the most frequently used addictive substance in India. Almost 30% of the population uses tobacco in some or other form. Smokeless, like chewing, is more common than smoking form. It is followed by alcohol. Alcohol is used in problematic or dependence pattern by more than 5% Indians. In some states like Chhattisgarh, Arunachal Pradesh, prevalence is more than 10%. Among illicit drugs, cannabis and opioids are prominent substances. Over the past decade, the number of people using opioids like heroin has increasing alarmingly. And as you can see, IV drug use also increased significantly. So, can behavior be addictive? So, there is a term frequently used nowadays, behavioral addiction, also known as process addiction. It encompasses activities such as online and offline gambling, and individuals struggling to reduce their internet usage or the time spent gaming. So, gaming disorder and gambling disorder are mainly discussed in terms of behavioral addiction. The symptoms, genetic predispositions, brain structures, chemistry changes, and available treatment options share similarities with substance use disorder. However, distinguishing a process addiction, especially internet addiction, from excessive internet use can be challenging. Furthermore, for many people, internet use is a necessity for survival, making complete cessation an impractical option. Nevertheless, from a public health perspective, we must address these issues, even though a comprehensive discussion is beyond the scope of the present video. So, how does addiction develop? Not long ago, people saw addiction as a moral failure or a lack of willpower. However, understanding addiction is far more complex. Even those struggling with addiction find it hard to explain. They often mention that using drugs no longer brings pleasure, yet they can't stop it. This loss of control over one's own behavior is puzzling and needs exploration. So, scientists began understanding addiction as a brain disorder in the 1950s, and it started through animal experiments. So, doctors Olds and Milner, in their rat studies, identified the brain areas affected by addiction. Not only that, they revealed that addictive drugs increase a chemical called dopamine. This dopamine is involved in brain reward circuit, in brain reward regions. This dopamine surge is much higher compared to natural rewards like food or sexual activity. As you can see in this picture, the red color line denotes the dopamine surge which will happen after you take a food, whereas the pink color or blue color are respectively for methamphetamine and cocaine. So it's much more higher. In 1994, scientists Volkow and Skilbert used brain scan called positron emission tomography. They studied how substance use disorder affect the human brain. They compared the brains of addicted people to those who weren't addicted. As you can see in this picture, those who are addicted have been compared to control, that is, those who weren't addicted. What they found is that in addicted individuals, the brain had fewer dopamine D2 receptors in the frontal regions. Those receptors are like switches that control the brain's ability to control impulses and make good decisions. This helps explain why addicted people often struggle with impulsive and compulsive drug use. This discovery was first made in cocaine users, later confirmed in methamphetamine users, alcohol users, and heroin users. To delve deeper, addictive drug use affects two main parts of the brain, the limbic system and the cortex. First, let us discuss about limbic system. Deep within the brain, the limbic system governs our basic survival instincts. When we engage in essential activities like eating, drinking, finding shelter, having sex, or caring for our young, the brain releases dopamine in this region as a reward for survival. This pleasurable feeling is also stored as a memory in the amygdala and hippocampus, encouraging us to repeat these behaviors in the future. This is our hardwired survival mechanism. Furthermore, addiction impacts the prefrontal cortex, brain's topmost area that sets us apart from other animals and regulates decision making and impulse control. So when alcohol or drugs are used, they activate the same dopamine process in the brain's reward or survival center. With repeated use, these substances can hijack the brain, weaken the system, and convincing it that the primary need for survival is the drug. By taking over these essential drives like hunger, thirst, shelter, sexual desire, and the instinct to protect our offspring, the hijacker compels an ever changing substance intake to attain the same degree of satisfaction or pleasure. This persistent drug use gradually harms the brain tissue. So, what are the symptoms of addiction? Symptoms of substance use disorder or addiction can be categorized into four main groups. The first category pertains to the level of control you have over your substance use, including using more and more often than intended, experiencing intense craving, wanting to quit but being unable to do so. The next category involves social impairment, which is evident in neglecting your responsibilities in relationship and giving up activities you once cared about due to your substance use. The third category relates to risky use, where individuals continue using substance despite experiencing physical and mental harm. The fourth category centers on pharmacological criteria, such as developing a tolerance, that is, needing more substance to achieve the same effect, and experiencing withdrawal symptoms when not using. Withdrawal symptoms can vary in severity depending on the substance and the extent of use. They can range from being painful but not life threatening, as seen in opioid withdrawal, to potentially life threatening, as observed in severe alcohol withdrawal. If left untreated, like many other chronic illnesses, addiction tends to get worse as time passes. As a substance use disorder advances, the chances of facing mental and physical health problems increase, overall well being declines, and the risk of lasting harm or even death becomes much higher. That's why starting treatment as early as possible is vital. What are the consequences of addiction? In 2015, 11.5% of global deaths were attributable to smoking worldwide, of which 52.2% took place in four countries: China, India, USA, and Russia. Smoking was ranked among the five leading risk factors to produce disability. As you can see in this world map, some of the areas of world are significantly affected by the burden of disease due to smoking. What about alcohol? So alcohol and drug also significantly contributed to global disease burden. In 2016, approximately 5% of disabilities measured in disability adjusted life years or DALYs were linked to alcohol use, while drug use accounted for 1.3% of disabilities. These effects extend beyond just substance use disorders and encompass various health consequences associated with their use. For instance, a considerable portion of the disease burden linked to alcohol arises from outcomes such as unintentional injuries, suicides, cancers, and cirrhosis. Similarly, the effects of chronic hepatitis C infection, including cirrhosis and cancer, substantially contribute to burden associated with drug use. So, why don't all people who use alcohol or drugs become addicted? But some do. So, studies have indicated that specific factors can increase the individual's susceptibility to addiction. They include individual factors like your genes contributing around 50%, your age of exposure. Earlier age of exposure actually increases your chance of getting addicted to certain substances. History of trauma, abuse in childhood also increase susceptibility of substance use. Conquering mental illness like depression, other mood disorders, psychosis also increases your susceptibility to addiction. And certain environmental factors like drug availability, poverty level, and crime level are also significantly associated with addictive disorders. Despite these risk factors, there is positive news. Addiction can be prevented through important protective measures. These include parental involvement, programs that enhance self control, restricting access to addictive substances, and fostering a strong connection to your community. Another crucial aspect of preventing substance use disorder is delaying the first use. In simple terms, prevention means holding off on trying substance during the vulnerable adolescent years when the brain is more susceptible. This delay is crucial because it reduces the likelihood of addiction as discussed earlier. Typically, individuals with substance use disorder starts using substance at a younger age between 12 and 18 years, making them more susceptible to addiction. So, all prevention programs should aim to increase protective factors and decrease modifiable risk factors to reduce the probability of addiction ultimately. Now, the next question is there any treatment for addiction or is addiction treatable? So, if the addictive substance, the hijacker, does take hold, keep in mind addiction is treatable. Advancements have been made in assessments, treatment programs, recovery supports, and medications to treat addiction. Brain scans show that the tissue in the limbic system and cortex can get better gradually once in recovery. We need everybody's help to expand the proper care to help crores of individuals and families and ensure that addiction is treated as a medical issue. Now, addiction treatment is not one size fits all, and the best treatment addresses a person's various needs, not just drug abuse. The treatment approach needs to be broad in scope, taking into account a person's age, gender, ethnicity, and culture. The severity of addiction and previous efforts to stop using drugs can also influence a treatment approach. Effective drug abuse treatments can include psychological or behavioral therapy, medications, or ideally their combination. Psychological and behavioral therapy vary in focus and may involve addressing a patient's motivation to change, providing incentives to stop taking drugs, building skills to resist drug use, replacing drug using activities with other constructive and rewarding activities, improving problem solving skills, building better personal relationship, learning and support through groups and self-help groups. Now, medications are an important part of treatment for many patients, especially when combined with counseling and other behavioral therapies. Different types of medications may be useful at different stages of treatment to take care of withdrawal symptoms, to stay in treatment, and to avoid relapse by decreasing craving. But be mindful that medical detoxification is a necessary first step in treating certain addictions, but it does little to change long term drug use. Research tells us that most addicted people need at least 3 months of treatment to reduce or stop their drug use, and that longer treatment times result in better outcomes. The best programs will measure progress and suggest plans for maintaining recovery. They also evaluate and treat for co occurring mental health issues such as depression and anxiety. Let's talk about recovery. Recovery from drug addiction is a long term process that often requires several episodes of treatment and ongoing support from family or community. Relapse does not necessarily mean treatment failure. The chronic nature of addiction means that relapsing to drug abuse is not only possible but likely. Similar to what happens with other chronic medical illnesses such as diabetes, hypertension, and asthma, and like these illnesses, addiction also requires continual evaluation and treatment modification if necessary. So, it's important to remember that drug addiction can be treated, but it's not simple. Addiction treatment must help the person stop using drugs or stay drug free, and at the same time be productive in family, at work, and in society at large. Here in Tejpur, Assam, LGB Regional Institute of Mental Health, an autonomous institute under Ministry of Health and Family Welfare, runs an addiction medicine department. Outpatient, inpatient, and emergency services related to addiction and other mental health disorders are available. Kindly visit us if you need help for yourself or any of your near or dear ones. Also, you can visit and subscribe to our YouTube channel LGBRMH Meet and Department of Addiction Medicine LGBRMH Tejpur for more informative videos related to mental health issues and addiction. Thank you.